Hello, welcome everyone. My name is Carlos Pedret, as you know, and as you can see, my face is turned into a face of a real YouTuber. Um, no, seriously. Um, let's try to make another article commentary. This is an article that it's quite complex about the term, so let's try to share a little bit of light in this concept, which is the fascia. Um, the article goes, it is all about the fascia, which is the real role of the fascial tissue in muscle injuries. The main basis of this article commentary is that one, um, which is this article here. It is all about the fascia. It's an article published on 2019 in Orthopedic Journal of Sports Medicine. It's a really interesting article talking about the fascial tissue. Um, and it's a systematic review, a meta-analysis. What it really says in its objective and its main role is that it's trying to summarize the scientific literature existing nowadays on the prevalence of fascial injuries in muscle strains and their association with the return to play process. This is quite complex to do. We will explain later why it is quite complex to do. Their basis is that excessive tissue loading, especially eccentric contractions, we know all these, has been suggested to represent the main injury mechanism. Obviously, we agree on that. The complex architecture strongly suggests a force transmitting on force absorbing role of the intramuscular connective tissue. Again, we really agree on that, of the importance of the muscle architecture and the extracellular matrix. So we agree on that, but this is a quite complex concept to talk about, because this obviously in my YouTube channel, this is all my opinion, but do we really know what do we want to say when we talk about fascial tissue? So in terms of histologically, in terms of metabolic, in terms of image, yeah, it's quite well defined. But in terms of injury, do we really know what we talk about when we talk about fascia? This is imaging studies. They selected imaging studies. A lot of it. They made this flow chart selecting studies. They finally get 15 studies specifying the injury location, diagnosis of the lower extremity strain muscle injury, only adults more than 18 years old, and studies according to MRI or ultrasound. So finally 15 studies. But okay, this is the main study we want to talk about, but we need to make a little bit of history about studies about fascia. It's not history, because all of them I will show are from 2 years ago, not more. This is the first one, which is in the Clinical Anatomy Journal. Fascial nomenclature, so update and related consensus process, and they define quite well when we talk about the fascial system and when we talk about aphasia. So it is really important to differentiate these two concepts, the fascial system and aphasia. So when we speak about fascial injuries, I think, in my opinion, that we talk about aphasia. And we still don't know exactly what is an implication that it has to be. So the fascial system, it's all the fascial that surrounds and interacts between and interpenetrates all organs, muscle, bones, nerves. So it's the surrounding tissue, and a fascia, it's a sheath or sheath or any other dissectable aggregation of connective tissue that forms beneath the skin to attach, enclose, and separate muscles and internal organs. So, and this is a very good article from British Journal of Sports Medicine. And it is also important, he says, also important to differentiate the concept of fascial system from the term fascia. So we are seeing here in the A picture the fascial system enveloping containers around within all skeletal muscles, and this is what we talk about when we speak about fascial structures and fascial injuries. And here we can see an electronic microscope image that says that internal structure of fascia tissue is dominated by collagen fibers. It's not a well-structured collagen fibers and embedded in a semi-liquid ground substance. So it's important to clarify these concepts, because then we're going to move to the injury concept of a fascia. And this is the same article in British Journal of Sports Medicine that says that as much stiffer or compliant the fascial tissue is, the most it can affect the magnitude of intermuscular force transmission, and arguably may have a significant effect on muscle mechanics. So it says that some aspects may increase fascial tissue stiffness, and some aspects may decrease, or it is unknown the relation between fascial tissue and these aspects. For example, aging, cross-linking, neuromuscular disease, extracellular matrix deposition, cellular contractility. So these are aspects that can increase the fascial tissue stiffness. Some others, like for example corticosteroids, may decrease this fascial tissue stiffness or stretch-induced tissue elongation. So we can act over this fascial tissue. But I leave a question here about what do you think for the fascia? It is better to be stiffer or to be softer? So I think this is a good question, and even more, we can go farther and we can say that for an aponeurosis or for a tendon or intramuscular tendon, is it better to be stiffer or to be softer? So we need to think about that, because this has a very hard implication in a muscle and tendon injuries and tendon pathology. So I'll leave a question here. You can leave your answers in commentaries if you want. But let's turn and let's move again to the previous injury, to the previous study, to the first study about saying it is all about the fascia. So we have this table here, which makes an association between fascial injuries and return to play aspects. So this is very interesting, and I'm going to explain a little bit in this table. Here you can see that there is one study of mine, and I can say, according to this study, that of course the return to play time and the type of central tendon involvement has a lot to do with the return to play time. First of all, look that all the studies say that as much connective tissue affected, the most return to play time, so the worst prognosis. But when we speak about fascia, I don't really think that we talk all about the same when we speak about fascia in these studies. For example, this study, I can talk about it. It's in the soleus muscle, and it was divided, the soleus muscle, according to central tendon injuries, lateral aponeurosis, medial aponeurosis, and at that time, I think it was 2013 or 2013 maybe. We called the posterior myofascial and anterior myofascial. As much as we have studied the soleus muscle, we define that anterior myofascial and posterior fascia as an aponeurosis due to the collagenous structure and the thickness of the tissue. So in that study, for example, we spoke about that the return to play time was worse in injuries affecting the central tendon, but the less important or the fastest return to play was in injuries that affects the lateral aponeurosis. And also the myofascial injuries in the soleus muscle, anterior and posterior, has a very long return to play. And I think that this is not quite, this is not really true nowadays, because anterior and posterior aponeurosis has the same return to play as a lateral medial or central tendon injury. So I think the point here is in the Prakash study that says that every single injury in the soleus muscle that compromises connective tissue, it doesn't matter, central tendon, lateral aponeurosis, medial aponeurosis, anterior aponeurosis, or posterior aponeurosis, has a worse prognosis than those injuries that does not affect this central tendon or this internal connective tissue inside the soleus muscle. So I don't know exactly how are the other injuries conducted, but I think that the most important thing is to define correctly what is it, a fascial injury, because when I go to the cadaver to dissect the cadaver and I talk to the anatomist, they have a very different vision of a fascial tissue of every muscle. So I think we have to define it quite good. So that's why I have another question here. Why cannot be found normally significant relations, as we can read here in that table, between fascial or myofascial injuries and myotendinous injuries? Probably because normally we don't define it correctly. So I think that a fascial injury, or if we want to speak about myofascial, we can do it. We know that it has a better prognosis than a myotendinous or tendinous injuries. But normally also in these studies, there is no significant relation. And that's probably because we do not know exactly how to define the fascial injury. Let's talk about a little bit of my conclusions about this article specifically. In this article they speak about, that's why I chose this article, because they speak about an elevated risk of bias also in how to choose the article. So I choose that because I think it's a really well methodological study. And my conclusions of this article are that the definition of fascial system and fascia, it's really well known by different consensus statements in a histological way or in a system way. But it also is important to know, and it's explained in every one of these articles, that based on a precise diagnosis, this is absolutely necessary. Athletes with muscle injury and associated connective tissue lesions should be treated with specifically tailored methods, not a protocol, not a standard, individualized treatments. And the term, and this is my opinion also, the term fascial or myofascial injury is still not yet well established when we speak about injury. And can we really speak about myofascial injuries? Do we really know what is a fascia of every muscle that we want to assess? So do we know the exact behavior of rectus femoris fascia? So which is the difference between a myofascial injury and a fascial injury? This is an important question, because do you think that the attachment between muscle and tendon, what we call a myotendinous injury, and a fiber, muscle and fascia, what we can call a myofascial injury, it's the same? So it's the same hard attachment between myofascia and myotendinous? And what is a fascial injury? Because a fascial injury is when the fascia is torn. So it could be different. So we have to think about all of these terms. And what about a prognosis of a myofascial injury? Here we can say that it is a good prognosis normally. Sometimes in some myofascial injuries, um, I let the players to play just with a mild discomfort in the lateral posterior fascia of the rectus femoris, not affecting any connective tissue at all, and they can play and perform normal. Uh, I let them play with a small hematoma in that part of the rectus femoris. So I think we can manage quite well and with a very few period of time myofascial or fascial injury. But we need to know exactly when to define that kind of injury, because I think that sometimes we use the myofascial term so easy and we really don't know exactly how to apply it to a concrete muscle or to a concrete injury. So that's all about this commentary of this article. I hope you enjoy, or I hope you can think about it a little bit. It's my goal to make you a little bit thinking of some aspects on some articles. And if you like it, please just make some commentaries if you want to answer some of the questions I made. You subscribe to the channel if you find it useful, and nothing else. Hope to see you here again very, very, very soon.